So, starting here. Also, we're going to take a look at the knee, the structure of the knee. So with our knee here, we've got our femur, of course, our top bone. We've got our tibia and fibula. But the one bone we haven't yet talked about yet is the patella. The patella is your kneecap. That's your kneecap there. And if you notice here, there's a tendon that goes from your patella all the way down to the tibial tuberosity. So that's why we talked about this landmark last week. Okay, so the patella and the tibial tuberosity are attached. And so all of these bones here, okay, they make up your knee. Predominantly, okay, just the tibia, the femur, and the patella. But remember that name patella, okay, that's the anatomical name for a kneecap. So with our knee there, we got two different articulations we're taking a look at. First one, the main one, is between the femur and the tibia. We call that the tibiofemoral joint. Tibiofemoral joint. So again, that's where the condyles of your femur sit on top of your condyles of your tibia. And this joint is a condyloid joint. We'll talk about the actions that occur there. Remember, when you see condyloid, know that you've got two different movements that happen at this tibiofemoral joint. The other joint we've got is the patellofemoral joint. That's where the patella sits on the patellar surface of our femur. And that's going to be a gliding joint. Because what happens here is, so your patella sits on the patellar surface of our femur, and when our knee flexes and extends, the patella glides along the patellar surface. So that's why we consider it a gliding joint. Next up, the ligaments of the knee. Ligaments of the knee here. We're going to start with the collateral ligaments. These are the ligaments that are on the outside part of the knee. And feel free to take a look at your models to help you get a 3D view of it. I'm not going to give you a knee on the quiz next week asking which ligament is this. So you don't have to do that, but I felt like the 3D version helped you get a better representation of what these ligaments are. So we have collateral ligaments. Okay, they're on the outside. We've got a lateral collateral ligament. So that's on the outside and attaches the femur to the fibula. We also got a medial collateral ligament that attaches the femur to the tibia. You can abbreviate that medial collateral ligament as MCL and likewise LCL. It doesn't matter to me. But the big thing I want you to emphasize here, and I want you to write this down, is the collateral ligaments prevent excessive movement going side to side. More specifically, they help prevent movements that occur in the frontal plane. So for example here, actually finish writing that down. All right, so you got your collateral ligaments on the outsides here. So we have the medial MCL and the LCL. They help prevent excessive movement of the knee joint this way. So it helps prevent excessive movement in that frontal plane. We don't want a whole lot, otherwise our knee goes like this, okay, and we tear one of those two ligaments. So it helps prevent excessive movement in that frontal plane. We also have other two. These are on the inside, and they are called the cruciate ligaments. otherwise known as cross. For all those who are Christians out there, talk about Jesus dying on the cross. That was considered the crucifixion. So cruciate, crucifixion, that's the Latin word for cross. And if you'll notice here, the anterior cruciate ligament, or ACL, and the posterior cruciate ligament, or PCL, they create a cross in the middle between those two condyles of the femur. Now these ones, I want you to write this down, they prevent excessive movement in the sagittal plane. They prevent excessive anterior-posterior movement of that tibia. So, if I got my knee joint here, okay, so it prevents excessive anterior and posterior movement of the tibia. Prevents that from happening. And again, since going forward and backwards there, that occurs in the sagittal plane. Now to know which is which, it's all based off of where the ligament attaches on the tibia. The ACL attaches on the anterior portion of the tibia, and then also attaches on the back side of the femur. Likewise, the PCL attaches on the posterior side of the tibia, then goes forward from there. But the name tells you where does it attach on the tibia. ACL on the anterior part of the tibia, PCL on the posterior part. So again, quick review here. Collateral ligaments. They prevent excessive motion medially and laterally, or prevent excessive motion in that frontal plane. Any Marvel fans here? Thanos, baby, Endgame is coming up. He had a lot of collateral damage when he brought that freaking moon down and boom, knocked out Iron Man. So this prevents collateral damage or collateral movement of the knee joint. Versus the cruciate ligaments, they help prevent excessive forward and backward or anterior-posterior movement of the knee. That occurs in the sagittal plane. Now, we've got special connective tissue between the femur and the tibia. We call this the meniscus. If you wanted to know it, plural, it would be menisci. And these two pieces of connective tissue, cartilage, they sit between the condyles of your femurs and your tibias. We've got a lateral and a medial. Now, the tough part about this connective tissue is that there's not a whole lot of blood flow that goes to the area. So if you've ever torn your meniscus, it takes a long time to heal if it ever gets to that point. A lot of times it never actually truly fully heals. And what you'll often see is there'll be a rip here, and part of it will stick out kind of like a flap. So if somebody has meniscus surgery, oftentimes what happens is all they do is they shave that flap down so it doesn't keep irritating your knee. But unfortunately, it's very difficult actually to get that meniscus to fully heal. Now the meniscus provides two different purposes. One is a little bit of stability. Not as much as your ligaments, but it does help stabilize the joint a little bit. But secondly, more importantly, it's kind of like an airbag or a shock absorber. So every time you walk, prevents the femur and the tibia from hitting. If you have a bone on bone, that's very painful. So if your cartilage is healthy, you can walk and run with less pain. So it's a kind of a shock absorber for your knees. Movements of the knee. like anything, when we're talking about our appendages, our arms and our legs, from the anatomical position, coming up is decreasing that joint angle, or would be knee flexion. So start, finish, that would be knee flexion. Coming down, making that joint angle greater, would be knee extension. So coming down, knee extension. But it also helps provide external and internal rotation. And this is why that tibial-femoral joint is a condyloid joint. Because not only does the flexion and extension happen there, but also external and internal rotation. Now make sure you underline it only happens when your knee is bent. When your knee is straight, external and internal rotation of the tibia does not happen. So again, what that looks like here. Here's my tibia, here's my femur. So there's a little bit of twisting that can happen at that tibia. And I want you guys to try something so you kind of get a better idea of how that works. So I want everybody to extend their leg out. So kind of stand out in front of you. And what I want you to do is I want you to put your hand, find the crease of your hip and go just below it. I want you to twist your knee in and out. What we should feel there is you should feel a muscle contracting. Now bend your knee and twist that knee in and out. What you'll notice, there's a lot less movement that occurs up here. And that's because there's a little bit of twisting that can occur at that tibia. Not a lot, but a little bit. And that's why coaches tell their athletes we want to land with bent knees. Because we land with our knees straight, only our hip and our ankle can absorb that impact, absorb those forces. Which is one reason why when people land with straight legs, they're at greater risk for getting an ACL injury. Versus the knee, if you land bent, if my knee drops in, that's okay. Because I can have a little bit of twisting that occurs at my knee, and that helps absorb some of the forces. So therefore we get the knee helping a little bit more with the hip and the ankle. Now, we don't want to see this happen, okay, but our tibia allows for a little bit to happen so that a person has a less likely of a risk to get a torn ACL. Again, for the most part, whenever we land, we want that knee to be in line with your toe. Unit 19, last bone units, looking at the foot in your face. We're about to get after it here. Now, the nice thing about our foot is it's very similar to the hand. Some of the landmarks and the naming are exactly the same, and some are just maybe slightly tweaked. So a lot of similarities between the hand and the foot. Let's start out with your tarsal bones, which are colored up here. Now remember, with your hand, specifically your wrist, we call these your carpal bones. Carpal bones, which are these kind of irregularly shaped bones next to each other. But in the foot, they're called tarsals. Kind of how I like to think about it is, when you're our toes, the letter T for toes, that means we've got our tarsal bones. On top there, in yellow, we call that the talus. Talus, letter T is on top. This bone articulates with your tibia and your fibula, or the bones of your shank. In purple here, on bottom, that's your calcaneus, otherwise known as your heel bone. This is your heel right here. Calcaneus, that's the largest tarsal bone of your foot. In blue, we got our navicular. In green, we got our cuboid bones. Now, if you take a look at your feet there, the cuboid looks more like a cube, or kind of like a square. So, if that helps you remember it here, cuboid bone, that's more lateral. Clavicular bone, that's a little bit more medial. And then in red here, we've got our cuneiform bones. Cuneiforms, and I want you to be specific with these. Now, just like our hand, our thumb was number 1, so our big toe was number 1. And then we count the rest of our toes through 5. So this cuneiform bone will be your first cuneiform, because it's on your big toe. The second cuneiform would be on the second toe. Third cuneiform would be on the third toe. Now, yes, you could alternatively call this the medial cuneiform, intermediate cuneiform, and lateral cuneiform. But frankly, I think first cuneiform, second cuneiform, third cuneiform, that's a little bit easier to remember. So those are all the tarsal bones of your foot. Now in your hand, the bones of your palm, we call those the metacarpals. Similar with the feet, but these are metatarsals, the letter T. Likewise, we want to be specific naming these, numbers 1 through 5. So I'd call letter A here, that would be your first metatarsal. Letter B would be your 5th metatarsal. So again, with these here, you just want to be specific. Fun fact, Jones fracture. Anybody heard of a Jones fracture before? This is my foot. So my freshman year at River Falls, I was playing football. It was my very first practice. So I'm jazzed up, I'm excited. We get done with warm-ups and we get the ball and we're doing some agility drills. And I plant to cut and I feel a pop. And then from there I felt immense pain in the side of my foot. And I felt bad. I was like, gosh, coach is going to feel like I'm weak, not tough. What's going on here? So I got it checked out and ended up fracturing my 5th metatarsal. And this is a picture after my surgery. They put a screw in that 5th metatarsal, and that screw is in my foot to this day. Fortunately, it doesn't give me any issues, so it must have healed up quite well. But if you ever hear a Jones fracture, that's your 5th metatarsal there that you fractured. You broke. It's a fun fact, don't need to know that, but some people might like it. Phalanges. Same as your hand. Fingers were your phalanges, so your toes are your phalanges as well. So our naming is going to be the exact same. Remember though, a few people last quiz, we called in our fingers, the singular form for phalanges needs to be phalanx. Some of you said, for example, that letter A was your first proximal phalange. No, this is going to be your first proximal phalanx. Phalanx is a singular form for phalanges. So next week when I have a sticker on one of your phalanges, the parts, remember that it's phalanx, not phalange. Phalanges is plural for phalanx. So letter A would be first proximal phalanx. C would be second distal phalanx. B would be second middle phalanx. So remember, we got proximal, middle, and distal for our phalanxes. Yes?
So for...
Or phalanges, I apologize, phalanges.
So for one there, would that be the distal, or first distal?
Good, so this would be the first distal phalanx. A would be first proximal phalanx. So notice your big toe here doesn't have the middle phalanx. And I apologize again, I said phalanxes, that was improper. Phalanges is the plural form for phalanx. Yes?
Would it be helix for the first one? So like when do you use that instead of phalanx?
From my understanding, the hallux refers to your entire big toe. That's the general name for your entire big toe. I'm going to have to look it up. From my understanding, this was always still phalanx, because this is a specific phalanx, this is a specific phalanx. In total, the entire thing, that would mean hallux. So just like your thumb was pollex, hallux refers to your big toe, entire region. But I will check that out and I'll let you know if that's different. This, again, is not going to be that important this week, but when we get to the muscles that move the big toe, hallux is going to be important. So just keep that in mind. So again, next week, be specific if we're talking about which specific bone we're talking about on your phalanges. Let me bring up the doc cam real quick so you can see all these in real time. Alright, so here's my foots. Here's a lateral view, the view from the outside. Up top here, that's our talus. Bottom here, your heel, that's your calcaneus. So this is your cuboid bone. See how it's kind of square, more like a cube? The other one here, that's your navicular. We've got our first cuneiform, second cuneiform, third cuneiform. Metatarsals, 1, 2, 3, 4, 5. And then we've got our phalanges, on top here, your toes. This will be the first proximal phalanx. This will be a first distal phalanx. This one will be a second middle phalanx. Question there about the bones of the foot. Landmarks. So there's a picture on your PowerPoint that you can use, but I'm just going to show the landmarks on the actual bone view. On your talus, right on top, this smooth part, that's the trochlea. This part on top of the talus is your trochlea. And this is what articulates with your tibia. So trochlea is the top of your talus. TT. Switching to a medial view. So this is a view from the middle, from the midline. We got this support shelf. Support shelf. Notice that. If you flip it to the bottom, kind of like a shelf. Here's a view from the side. We call this the sustentaculum tali. And I really want you to emphasize the T's here. Sustentaculum tali. Lots of T's there. That'll help you remember how to spell it. But the sustentaculum tali is your support shelf for your talus. The talus sits on top of that sustentaculum tali. Flipping into a bottom view. Right here, this bump. This is the medial tubercle of your calcaneus. Medial tubercle. Flip it. You see it kind of sticks out a little bit. It's your medial tubercle. And this is where your plantar fascia attaches. Your plantar fascia is a bunch of connective tissue on the bottom of your foot. And people who have had plantar fascia pain will often feel it somewhere along this foot and a lot of times at this attachment point. So this is the attachment point for your plantar fascia. Lastly, on your fifth metatarsal, you got a pointy part of the bone. That's your styloid process. Styloid, thinking stylus, just like a pen, or something you write with, you write a different writing style. Styloid process is a pointy part of the bone. There's a styloid process in your fifth metatarsal. questions on those land numbers? Again, feel free to use this picture here as much as you like here when you're studying. Different view of it. Now, just like with the hand, we got a lot of different articulations, or the bones come together. We'll start at the ankle and move our way to the toes. Start with the talocrural joint. Talocrural joint. That's where the talus and the tibia and the talus and your fibula articulate. So right here. Now at this joint, this allows for dorsiflexion and plantar flexion of your foot. So I'm coming here. So that joint allows for dorsiflexion and for plantar flexion. However, the subtalar joint, sub meaning submarine or underneath, talar, talking about the talus, that's where the talus and the calcaneus articulate. That's going to be right here. Now, this joint, this is what allows your foot to do inversion and eversion. Inversion, the bottom of your foot pointing in. Eversion, bottom of your foot pointing out. So we see this like this motion. We can move our ankle all the way around. So some people think this is a ball and socket joint. But it's not, because, number one, I don't see a ball here. But number two, we've got these two joints, dorsiflexion and plantar flexion, inversion, eversion, that allows our ankle to move the way it does. So it's a combination of the talocrural joint and the subtalar joint, which allows our ankle to move all around. Now, just like subtalar joint tells you where it's at, mid-tarsal joint, in the middle of your tarsal bones, that tells you where it's at. So that's going to be right along here. Mid-tarsal. And that's where your talus articulates with your navicular bone. Calcaneus articulates with your cuboid bone. Mid-tarsal in between. And these are gliding joints. Just like your carpal bones in your wrist are gliding joints. That mid-tarsal joint in between your tarsal bones, that's also going to be gliding. Same picture, different slide. Tarso-metatarsal joints between your tarsal bones and your metatarsals. So that's going to be right here. Just like with your hand, these are going to be gliding joints as well. So we can glide past one another a little bit. Between your metatarsal and your phalanges, we've got our metatarsal phalangeal joints. So that's right here. And that's what we think of when you think of the ball of your foot. So I'm coming here. Okay? When I point my toes, okay? So right here, here's the ball of your foot. So that allows for this movement here of the foot. Now, just like your first knuckles here of your hand, that allows for toe flexion and extension, but also abduction and adduction. So flexion and extension, abduction, and adduction occurs at that joint. And then lastly, we've got our interphalangeal joints. Inter meaning between, phalangeal, phalanges, between your phalanges. So those are going to be right here. Whether we got our proximal interphalangeal joints or our pips. Or we've got distal interphalangeal joints or dips. Those, just like with your fingers, those are hinge joints. They can do flexion and extension. So your interphalangeal joints, okay, flexion and extension occur at that. So those are hinge joints. Questions there about those articulations? Now, with our arch, we have a special shape to the bottom of our feet, shaped like an arch. And if there's any architecture or math nerds in here, an arch is one of the strongest shapes that we have out there. That's why you'll see on a lot of old buildings, okay, you'll see that arch. Any basilicas you see out there, there's an arch. Any domes out there, there's an arch. And that's because that shape helps provide a lot of support. For those of you, if you watched the cathedral in Notre Dame that was burned, something set it on fire. The outside of it was burning like crazy, but if you take a look at the pictures on the inside, there's this big old arches, and the arches were actually maintained. Now, partially that was because they were made of marble, but partially it was also possibly due to the shape of it. It was a stronger shape, so it was less likely to collapse. Now, on our bottom of our foot there with this arch, we got three different arches we're looking at. To keep it very simple, the medial longitudinal arch, that's along the medial portion of your foot, closer to your big toe. The lateral longitudinal arch, that goes from your heel, but more towards your pinky toe. And then we got our transverse arch, goes directly across. Feel free to look at your lab manuals for that, okay, to know what bones it crosses. But essentially, if you know where the first three cuneiform bones are, okay, that's on the medial portion. Okay, that means those bones are a part of the medial longitudinal arch. We're talking about the fourth and fifth metatarsals. Okay, we're talking about the clavicular bone, or cuboid bone, I apologize. Your cuboid bone there. That's a part of your lateral longitudinal arch. Transverse arch there essentially goes across your tarsal bones and the proximal portions of your metatarsals. So don't worry about the exact details, but if I ask you what is the arch that lies along the first tarsal bone, you should know that that's going to be the medial longitudinal arch, because that bone, the first cuneiform there, that's going to be on the medial portion of your foot. Questions about the arches? Lastly, ligaments of the ankle. Ligaments here. On the medial portion, or on the inside of your ankle, we got two. One is the deltoid ligament. So you see up here, we got three of them that are showing, and there's one that's underneath, that's more deep. But I kind of like to think about it as your big shoulder muscles. We got three different deltoid heads. So the visible deltoid ligaments, we got three there. The only difference is that's on the inside, or the medial portion of your ankle. So that's the deltoid ligament. We've also called what's called the spring ligament. Spring ligament, more specifically, is called the plantar calcaneonavicular ligament. The name should give it away. Calcaneo meaning calcaneus, navicular, the navicular bone. So between the calcaneus and the navicular bone there, that's going to be where this ligament lies. So here's the calcaneus, here's the navicular bone. So it's this ligament here that's underneath this ligament right there. We call that the spring ligament because it's one of the most important ligaments that helps maintain our arch in our foot. If you tear that ligament, most likely you're going to have a hard time pushing off. Hard time producing force there when you're moving. Lastly, on the lateral portion, you've got 3 different ligaments on the outside. Yes?
I just had a question. So my sister, she like ran cross country and she like lost her foot arch. Like what causes that? Like so the bottom of her foot is just flat.
So one, it could be genetics. So if this is, whether it's the ligaments aren't as strong, maybe it's the way the bones come together, maybe the way they were formed. So that could be flatter feet. So that's one thing. Number 2, if there was any damage to the ligaments, I would assume that would make your feet a little bit flat. Thirdly, it might depend on how she walks or something like that. For example, if people have a tendency to walk with their toes out and their knees forward, when I push off here, okay, all that force is driving down there. So if I'm walking with my toes pointed out a little bit more, you might tend to be more flat-footed. So it's kind of a bunch of different possibilities for that. Unfortunately, I'm not a doctor, so I don't know exactly, but it's a good question. Lateral ligaments there. The names give away where they attach. Okay? So we've got an anterior and posterior talofibular ligaments. Talo meaning talus, fibular meaning fibula. So here's your fibula, here's your talus, we've got an anterior and posterior ligament. You can abbreviate that as ATF and PTF if you would like. No WTFs in here though, unfortunately. Now, specifically the ATF, this is one of the most often torn ligaments in the body, or stretched or whatnot. Because typically, okay, our foot, we're going to sprain it like this. Okay? And oftentimes that's the ligament, that one in front, that's the one that rips or tears the most off. So if you've ever rolled an ankle, you've got a better chance that it was probably the ATF ligament. Most of the time, we do not sprain these ligaments. So I'm going to come in here. Rarely, you can ever see anybody sprain an ankle like this. Most of the time, it's always going to happen like this. And then lastly here, we got the calcaneofibular ligament, between the calcaneus and the fibula. So those 3 ligaments make up the outside part of the ankle.